It's not even that. Why don't you worry about your son and the people that speak your son? Like, what? Like, you keep saying.
So allegedly, Chrisean Jr.'s medical records been leaked. I don't know how true it is, but it's saying that he got all type of stuff and how she was being neglectful.
So apparently somebody that leaked Chrisean Rock and Jr.'s medical records from when he was born, listing the list of issues that he had. One of the issues being alcohol fetal syndrome, another one dealing with his ophthalmology, dealing with his sight, something else dealing with pulmonary, dealing with his lungs.
Shouldn't even have to apologize to you because we all was drinking, even you, with the baby and stuff. Why are you lying? Now you go.
You did pull
up
to your show drinking.
There you
gave me the bottle.
There you go.
Okay, you gave me the Hennessy bottle.
There you go. There you go. You
so I'm just not about to act like
you putting us in. You putting a narrative out there.
What narrative?
You trying to say I drunk? Nigga, I never drank the bottle. Because I never was.
Who was drinking?
I never drank the bottle. You know I didn't drink the bottle.
So, okay. Because you just keep working.
The baby's blessed. His name is Chrisean.
Welcome back. Chrisean Rock's relationship just became very tumultuous. Yes, it is about her child. Chrissy and Junior are back together. But the drama is different this time. It hits differently this time. It's profound and, to be honest, somewhat tragic. Here's a scoop, then. Due to some purported medical screenshots connected to Chrissy's pregnancy with Junior, Twitter and TikTok are going crazy. Don't trip now. Since we want to maintain everything polite and legal, we won't be displaying any of those pictures here. But because these statements are causing a major uproar, allow me to explain it to you.
Say this, okay? Chrisean leaked her own medical records. You don't have to go try to figure out who leaked them or anything. She did. It's something mental really going on with that young lady and she really needs help, okay? Those medical records basically show what Chrisean Jr. had and also the therapies he was going to need, okay? Now, it's so sad because it was a lot of stuff on the medical records that Chrisean Jr. supposedly had. And on top of that, it kind of named a couple that Chrisean actually had her system at the time that she was pregnant. Plus, in all reality, the medical records was basically showing what everybody was assuming about Chrisean Jr. anyway. So why she keep on getting on the internet and calling herself bullying and trying to get into it with this and the third and Tia Kemp because people genuinely try to tell her to get her son off the internet and get him the help that he needs.
Screenshots purport to display the baby's marked health notes, although nothing has been verified. This is a type of information that quickly sparks heated discussions and whispers. Rumor has it that some of these purported documents claim Chrissy has not been attending the baby's doctor's appointments as regularly as she ought to. Naturally, the internet is in full-blown meltdown mode, with people making fun of one another, raising eyebrows, and making outrageous charges all over the place. However, let's not act as though this was unexpected. Ever since Chrissy made her pregnancy public, she has been scrutinized on social media. Everything she does, including the way she carries her child, the places she travels to, and the people she spends time with becomes breaking news. And people are drawing conclusions more quickly than ever before, as a result of these alleged medical leaks.
So apparently somebody that leaked Chrisean Rock and Jr.'s medical records from when he was born, listing the list of issues that he had. One of the issues being alcohol fetal syndrome, another one dealing with his ophthalmology, dealing with his sight, something else dealing with pulmonary, dealing with his lungs.
It's saying that he got all type of stuff and how she was being neglectful.
Rock. So there's been some medical documents that have been released that people were saying are the medical documents of Junior, Chrisean's son. I'm going to tell you where to go to watch this on YT in a minute.
But here's the real deal. Hardly anyone is actually asking, who leaked this supposedly confidential information in the first place while everyone is preoccupied with playing judge and jury? If this is true, there has been a serious invasion of privacy, without a doubt. It's obvious that someone went out of their way to find this information, and that in and of itself shouts that there is a major mess occurring behind closed doors.
Okay, who's out here breaking HIPAA laws? Apparently, there's some medical records of Chrisean and her baby floating around, and I don't know if it's true. This is all alleged, but I'm just gonna share what I learned. Maybe, allegedly. So it says that the baby suffers from fetal alcohol syndrome and neonatal abstinence syndrome. So neonatal abstinence syndrome is basically the baby is withdrawing from opioids, some sort of drugs, but they're thinking either opioids or cocaine in this case. And allegedly, but he also allegedly suffers from spasticity, which is like a neurological disorder that makes it hard for people or babies to move their limbs. He also suffers from seizure disorder and CVI. Now, CVI is cortical visual impairment, which is just, it means that a part of his brain has been damaged, the part of his brain that controls his vision. So he has blindness. Like a lot of people, I've heard people say this, but I just didn't believe it, but oh my God. It also says that he should be in palliative care. Now, I work in hospice, and a lot of people, they believe that palliative care and hospice is interchangeable, but it's not. Palliative care kind of focuses more on prolonging the life of the child or person in general. But in this case, if he should be on palliative care, he's got a very serious medical condition, and he ain't gonna, she needs to be taking care of him. How? As a mother, do you know these diagnoses, or do you know any of this information about your son and not help him in any way? Continue to live the same lifestyle that you lived before you had him.
Let's not mince words. This is the crazy part. I'm not saying that these released files are entirely authentic, but I'm also not saying that they're not. The internet is turning this into a complete catastrophe. So I'm just dissecting what people are saying online and outlining exactly what has been observed in those viral posts. According to screenshots purportedly taken from medical records, Chrisean Jr. reportedly tested positive for cocaine, alcohol, and painkillers during birth, all three indeed. Social media is in a panic over that. The same additionally, a number of documented illnesses are listed in screenshots, including cortical visual impairment, or CVI, newborn abstinence syndrome, seizure disorders, and spasticity. In case you are unaware, CVI is not related to blindness. It occurs when the brain finds it difficult to interpret what the eyes are seeing. This whole neurological problem is quite significant. Even if this is all alleged, folks are shocked by the level of detail in those posts. And it doesn't stop there. According to reports, a full team of medical professionals, including neurologists, cardiologists, orthopedic specialists, and possibly even more, are already caring for the baby.
So there's been some medical documents that have been released that people are saying are the medical documents of Junior, Chrisean's son. I'm going to tell you where to go to watch this on YT in a minute. So I don't know if these are actually Junior's medical records, but I will say that the medical records appear to have been written by a medical professional. Just the terminology that was used and stuff. Okay? I do believe there's somebody's medical records. All right. Now, the one thing that makes me a little leery about it is it says that the mother admitted to prenatal substance abuse, and it listed some substances that she admitted to. I just find it hard to believe that Chrisean would ever even admit that.
That child has a long, difficult journey ahead of them from day one if any of this is true. However, this is what truly set the internet on fire. According to one section of the purported screenshot, the mother, Chrissy, acknowledged regularly using cocaine and alcohol while pregnant. If that is even partially accurate, people are asking for clarification. They're questioning parental rights, demanding accountability, and even bringing up the possibility of legal repercussions. Let's clarify one issue: the authenticity of these documents has not been formally verified. Although none of this has been confirmed, the fact that such extremely private information is circulating online demonstrates how out of control the entire situation has gotten. Oh, the internet is going crazy over what happened next. This is what transpired. The account King Cave was the first to post the screenshots. However, when I attempted to view that profile on my own, it was abruptly removed, deactivated, erased, or possibly removed. The timing is far too suspicious to be a coincidence. But no one can be certain. Many are speculating a lot, claiming that the account was likely flagged for the type of information it was promoting, because what they posted sent social media into a frenzy. This individual didn't keep anything back. They outright charged that Chrissy, her group, and even Blueface were concealing the true truth on the health of Junior and baby Chrissy. They asserted that the public was misinformed and given the impression that everything was okay, and the baby was doing well. However, these fresh accusations are now presenting a very different image. I mean, it exploded when I say the post went off. The account essentially stated that since the evidence is in front of everyone, there is no defense, and that the child's condition is sufficient proof. The truth is that child was one of the insults directed at those who continue to support Chrissy. Don't ignore it any longer. It was uncooked. It was brutal. Additionally, it left others stunned.
It's saying that he got all type of stuff and how she was being neglectful. But my thing is, if the doctors test the babies after they were born and they see that something, like if she was doing substances or something, she would have had to suffer the consequences. So I'm not sure if everything is true or not, but whoever did leak that is about to face some serious charges because the HIPAA laws. Like, why would y'all leak that anyway?
To ensure there is no misunderstanding, let me reiterate this. There was no official confirmation or verification of any of this. Who obtained those screenshots, how they obtained them, and whether they are authentic are all unknown to us. What is genuine, though? How quickly the entire incident is becoming viral on the internet. Reddit posts piling up like invoices. People on TikTok are piecing together videos, rewatching previous live streams, analyzing each body language and facial expression, and even pausing for any medical indicators. Twitter is in complete pandemonium. Arguments are surfacing in the comments, hashtags are trending, and individuals are even naming CPS in viral tweets as if it were a digital hotline. The internet is already rendering judgments on whether or not this stuff is true. Additionally, the harm to Chrissy's reputation is occurring in real time. We are dealing with defamation that may take a very different turn if these claims turn out to be false, but this might have major repercussions if there is even a shred of truth to it. Seeing how quickly the public is changing is crazy. People who are actively supporting Chrissy are abruptly pausing and posing queries such as, what's actually happening here? The internet has formally been divided. Some are taking it quite seriously and claiming things like, we knew it all along. Others are retaliating, accusing Chrissy of being the object of a targeted, disorganized smear effort. Whatever your stance, there's no doubting that this drama is gaining popularity and that everyone is glued to it like it's the premiere of a crazy Netflix documentary. Well, let's face it, I had to investigate this myself. This story is going to get much more serious if those screenshots are authentic, and the baby indeed had drugs in his system when he was born. Wouldn't the infant have been taken immediately? By now, wouldn't Chrissy be the subject of an investigation or something? That's the reasoning that many people are using. Hold on, though. It's not that simple. After doing some research, I discovered something that most people are unaware of. Not everything is black and white. Yes, hospitals are legally obligated to notify Child Protective Services or the state's child welfare agency when a newborn tests positive for a particular substance. That's the law, particularly when there are several substances involved, as in this case. However, what follows? Well, it depends. Not every time CPS arrives with sirens and takes the infant right away. Occasionally, they will let the child stay while closely monitoring the situation. If the parent begins to cooperate or already has a care plan in place, sometimes they keep a silent eye on things depending on the state hospital protocol and the severity of the baby's health. There may be other instances where a low-key investigation is underway while the child is still with the mom. Now, an investigation would undoubtedly be launched if Chrissy did allegedly confess to using any illegal substances during her pregnancy, and if medical professionals recorded it. This is where it becomes complex, though. Demonstrating injury, malice, or long-term danger. The legal aspect becomes extremely complex at that point. Therefore, it doesn't follow that nothing is going on behind the scenes. Just because we haven't witnessed anything unfold in public, these systems operate quietly and slowly. But when they do act, they do so with great force. You can be sure that someone is already on it if even a portion of their assertions are true. This is a section that most people are unaware of. They are not immediately removing the baby from the house just because a report is filed. Yes, I was also taken aback. There are far more layers to this whole affair than people realize. Let me explain it simply because people are making rash assumptions about this stuff on the internet without understanding how it really works. The hospital is not just overlooking the fact that a newborn purportedly tests positive for any type of prohibited substance, as is the case here. Not at all. They have a legal obligation to call that CPS hotline and report the incident right away. It's not a recommendation, that's the law for a period. However, CPS doesn't immediately show up and start removing infants as soon as they receive that call. They do this by carefully examining the entire situation. They determine whether the parent is capable of caring for the child. Is the infant being appropriately fed, changed, and transported to doctor's appointments? The house is stable, clean, and safe, and it's more profound. Is the parent receiving assistance, attending counseling in a treatment program? They inquire. Is a family member offering assistance? They're attempting to determine whether this is a difficult moment or a simple safety concern. If they notice Too many warning signs. They have other options as a parent completes a case plan. CPS may temporarily remove the child, whatever they believe is necessary to protect that child. They can impose therapy requirements, arrange supervised visits, set up drug tests, and order parenting programs. Additionally, don't assume it's a quick repair. That case file remains active for some time after it is open. A caseworker may occasionally be assigned to do pop-up visits to ensure that everything is proceeding as planned and that progress is being made. Here's the actual deal, though. Sometimes, if the parents are cooperative, clean, put out effort, and follow the plan, they will allow the infant to stay, but under strict guidelines. Therefore, don't misunderstand. Even if the baby wasn't taken out right away, there may still be a file in someone's system right now with their name on it. And that's precisely the reason why people are currently giving this whole scenario the side eye. This is when things become even messier, because a newborn does not necessarily need to be removed from the family just because they exhibit symptoms of drug exposure. This is where court-monitor procedures, drug testing, and rehabilitation begin to play a significant part. Additionally, the infant can lawfully remain with the parent, Chrissy in this case, if she is working with child services, adhering to the court's orders, and putting forth effort. Yes, exactly, if she's meeting the requirements. CPS may allow her to keep the child with limitations. Despite all those alarming claims that are making the rounds online, they will undoubtedly monitor the situation and may even dispatch someone to make unexpected visits. However, they don't always immediately dissolve the family if she is demonstrating that she is making an effort. Let me state this clearly now. All of what we are discussing is still alleged. The origin of these so-called medical records is unknown. Furthermore, nothing has been verified by any reliable source as of yet. The screenshots may appear authentic, but until an official announcement is made, this is all conjecture online. But there's more to it than that. The question of whether Chrissy is even stepping up as a mother is currently being debated online, particularly if Junior indeed has those purported ailments. Some are blaming her for not doing enough for him. Critics are being vocal, saying she isn't taking initiative, treating him well, or being there as a mother in that role ought to be. Additionally, the internet is consuming everything as if it were a reality show in the courts. The problem is that we have no idea what's actually happening behind those doors. Chrissy's residence is not where we are. We don't watch what goes on every day, nor do we wait through those doctor's appointments. It's possible that she is working hard behind the scenes. She is doing her part even if she isn't providing updates around the clock or live broadcasting every hospital visit. To be honest, she doesn't have to provide the world a detailed account of the baby's journey through medicine. The health of that youngster is confidential for a period. We have no right to demand updates as if we have a right to every detail, unless she decides to speak out about it. Being concerned is one thing, but it goes too far when her private life is turned into a reality show for the public. The actual question that everyone is asking is, should she be ensuring that the infant is receiving all the support and care that he requires? Of course, without a doubt. But does she have to provide us with evidence, justifications, or invoices? Number honestly, she doesn't have to post anything about it to the public, as long as she's acting in her child's best interests and in accordance with the law. Regardless of your stance, let's face it, everyone secretly hopes she's taking charge and looking out for her child. That infant is deserving everything, real attention, all the resources, and first-rate care. On that, there is no disagreement. But we must stop pretending that things don't happen if they aren't online. Not all nice Ds require a camera. She's not a bad mother just because she doesn't post from the waiting room. However, my mouth dropped when I came upon those said documents while browsing Twitter and TikTok. If even a small portion of the information listed there is accurate, it is extremely weighty. It's devastating. However, those files have not been verified yet. We have no idea where they originated. The entire situation can be a fabricated plot to maintain the drama. However, if any of it is even remotely true, then this circumstance is way deeper than anybody anticipated. The entire scenario is a clear wake-up call, and if anything is being ignored, let's hope that all of this internet chatter leads to actual action for that baby's future and well-being, not for publicity or influence. When all is said and done, it is what counts. I have to turn it back to you now. How do you feel about all of this? Have you noticed the screenshots that are circulating? Is there any truth to them in your opinion? Or does it seem like someone is fabricating an entire narrative to garner attention? Leave a comment below with your thoughts. Don't be shy. I want to hear every viewpoint, hypothesis, and approach. Additionally, while you're in the comments, be sure to hit that similar button. It is quite beneficial to ensure you don't miss any of these insane celebrity in-depth analyses. Don't forget to hit the notification bell and subscribe. We always break it down with receipts and keep it honest and unvarnished. Here at Juicy Plug, we remain locked in. We have everything you need, whether you're here for the information, the tea, or the mess. I hope you won't want to miss the next one, and I'll see you there. When the next video appears on the screen, tap it. More celebrity drama that is as outrageous, untidy, and shocking as this one is on the horizon. Stay alert, curious, and attentive. Till the next time, because this tea never stops pouring.